The first important achievement of this hospital is the introduction of phacoemulsification, the ultrasound cataract operation in our country. This method that became reality at the beginning of 1970s, thanks to a great innovator, Dr. Charles Kellman, has been brought to perfection in this institution. The most important achievement of the hospital Sveti Vid is certainly the fact that its work has an impact on the modernization of domestic ophthalmology owing to the introduction of new, modern methods and offering greater possibilities for patients. Superior contemporary ophthalmology has become available to patients in our country. This improvement of domestic ophthalmology is present in the field of cataract surgery, glaucoma surgery, and refractive surgery. The improvement has been also achieved through the introduction of photodynamic therapy, PTD, reconstruction of the anterior segment of the eye in order to solve problems arising due to a previous inadequate surgical procedure, etc. In this area, Sveti Vid has also introduced a combined procedure, cataract operation and vitrectomy at the same time, the so-called phaco-vitrectomy, where in one operation cataract is operated simultaneously with changes in the posterior segment of the eye when a combined problem exists. In this way, faster and better rehabilitation of visual function can be achieved. Patients that undergo this type of surgery are mainly diabetic patients, then patients with ablations and eye traumas. This surgery may be considered a type of neurosurgery in the eye, and it is very complex and dependent on technological conditions, as well as on the experience and skills of the surgeon. This hospital has introduced in the country the ultrasound cataract operation, phacoemulsification, a method which has been applied in the world of ophthalmology since 1971 and which has been brought to perfection today. The highest level of this surgery is present just here in Sveti Vid, offering to people the highest quality of surgery in the country without any need to go on expensive trips abroad. Phacoemulsification offers the possibility of operating cataract in the earliest stage of the disease, at the very onset of the first symptoms, instead of troublesome waiting for cataract to be mature and passing through temporary blindness which was unavailable in the field of surgical approaches. The ultrasound method is small incision surgery today with an incision of less than 2 millimeters, with the application of a foldable intraocular lens selected in accordance with the ophthalmic problem and the patient's needs. Patients are particularly happy with the selection of multifocal implants, which provide comfortable near, far and intermediate vision independent on glasses. This triumph over presbyopia is the culmination of refractive surgery, a name for the achievement of which efforts have been made for decades. As a result of his pursuit of higher and better goals, Professor Roosevelt won the first prize at the International Congress of Innovative Ophthalmology held in Bombay in 2008. For the first time, the possibility of phacoemulsification was presented in solving the problem of an eye with trauma that had been without visual function for years. A pediatric department has been also established in Sveti Vid. This department is headed by a renowned pediatric ophthalmologist, Professor Dr. Rudolf Autrata, who has won prestigious awards for his work and for the development of pediatric ophthalmology. At the European Congress of Pediatric Ophthalmology, held in Barcelona in 2008, he won the first prize in the field of refractive surgery and the application of excimer laser in children in special situations aimed at reducing amblyopia. Besides these interventions, he performs all other interventions in the eye in children.